Hillary, we've been working together for so many decades that I can hardly count them anymore. Working always to make a difference for women and their families. I'd like to just spend a few minutes talking about what should that agenda look like for the next few years. What ought we be doing now to make sure that families are able to take care of their kids, their parents, their spouses, all the things that make a difference?
Well, Judy, I want to thank you for your years of work on behalf of women and children. We have been working together for years, and you're asking the right question. What do we do now? Well, we could start by making sure that working families are getting a decent wage. That's why I think we must raise the minimum wage. Minimum wage workers haven't had a raise in nearly a decade. The last time the minimum wage was raised was 1997, and just think of how the purchasing power has been eroded, in fact, by about 19% for those who are working for minimum wage. And in that time, members of Congress have given themselves 8 annual raises. And securing raises for ourselves while denying wage increases to the lowest paid workers in this country, a majority of whom are women, is just shameful. One telltale sign of the devastating impact of low wages is the number of children living in poverty, which has steadily increased since 2000. We were lifting kids out of poverty in the 1990s. Now they're falling back into poverty. How can Congress continue to regularly give itself a raise while refusing to raise wages for the more than 7 million men and women who work hard and can barely afford to survive, let alone support a family? So we should start by raising the federal minimum wage so that working parents can lift themselves and their children out of poverty. It is past time to make this investment in our children and families.
Now I want to talk about an issue that you and I have worked on for so long, the Family and Medical Leave Act. What a difference that made for millions and millions of families since we finally got it passed and since it was the very first bill that President Clinton signed into law barely 2 weeks after he took office.
That was such a great moment when finally, after all those years of effort, after vetoes by the previous president, we got it signed. And look at the big difference that it's made for families. Now you can stay home with a sick child or a parent or a spouse. But I also know that many more people can't use the Family and Medical Leave Act because they can't afford to give up their paycheck. That's why I'm a co-sponsor of the Healthy Families Act. That would ensure that eligible employees do not have to choose between the competing demands of work and family. Judy, you know so well that today's families are stretched thin. They're working hard to make ends meet while also trying to carve out time to care for their young children as well as their parents and grandparents, and to say nothing of taking care of themselves. In America, close to half of all private employees have no paid sick leave, and many more are unable to take time off to care for a sick child or other loved one. That's a terrible squeeze on working parents.
So how would this bill build on what we know are the wonderful aspects of family and medical leave?
Well, this bill, called the Healthy Families Act, would provide workers with 7 paid days of sick leave, giving parents time off from work to go to the doctor's office with their children or aging relative, or to address their own health needs. Facilitating regular medical care can save money by preventing illness and injury and decreasing the need for emergency care. A recent study done by Cornell University, which I'm very proud of, right in New York, found that employees coming to work despite being sick, despite medical problems, costs $180 billion annually in lost productivity. And, it may be much more costly to employers than just staying home or going to the doctor because you're ill. Paid time off for medical purposes would make employees more productive, and frankly, it would prevent the spread of illness in workplaces and schools. That, in turn, would make for healthier and stronger families and healthier and stronger workers.
Senator, I want to thank you so much for your work, your ongoing dedication for women and our families. We owe you a great deal.
Well, we've been fighting on these issues for a long time, and we've made a lot of progress, but we need to keep working because There are a lot of parents out there who are stretched so thin, and they need some help being the best parents and the best workers they can be.
Thank you.
Thanks.